NLN NEX Reading Practice Questions. Question 1. Which inference is best supported by the passage? A chart shows pulse rates before and after exercise, with higher rates after activity in this solution chemistry item. Option A. Pulse is unrelated to activity. Option B. Exercise can increase heart rate. Option C. Exercise always lowers pulse. Option D. Charts cannot show change. The correct answer is option. The before and after pattern shows increased heart rate after exercise. Pulse is unrelated to activity, is not supported by the passage. Exercise always lowers pulse, is not supported by the passage. And charts cannot show change, is not supported by the passage. Question 2. During a quick NEX review of a genetics clue item, which inference is best supported by the passage? A paragraph begins with a claim, gives two examples, and ends by restating the claim. Option A. The claim is hidden in a footnote. Option B. The paragraph has no conclusion. Option C. Examples are unrelated to claims. Option D. The structure supports the main idea with examples. The correct answer is option. The organization uses evidence to reinforce the point. The claim is hidden in a footnote, is not supported by the passage. The paragraph has no conclusion, is not supported by the passage, and examples are unrelated to claims, is not supported by the passage. Question 3. After checking the choices in a cell division item, which inference is best supported by the passage? A patient skips breakfast before a long class and later has trouble concentrating. Option A. Concentration is unrelated to food. Option B. Classes prevent hunger. Option C. Nutrition may affect attention and learning. Option D. Skipping breakfast always improves focus. The correct answer is option. The passage connects lack of food with difficulty focusing. Concentration is unrelated to food, is not supported by the passage. Classes prevent hunger is not supported by the passage, and skipping breakfast always improves focus is not supported by the passage. Question 4. If a bone support stem gives one clear clue, which inference is best supported by the passage? A report says infection rates fell after staff completed a hand hygiene refresher. Option A. Training increased infection rates. Option B. Training may have improved compliance with hygiene practices. Option C. Hand hygiene cannot affect infection. Option D. The refresher removed all risk permanently. The correct answer is option. The sequence suggests training supported better hygiene behavior. Training increased infection rates is not supported by the passage. Hand hygiene cannot affect infection is not supported by the passage, and the refresher removed all risk permanently is not supported by the passage. Question 5. When time is limited on a muscle movement question, which inference is best supported by the passage? A tutor tells a student to eliminate choices that contradict the passage before guessing. Option A. Guessing is always better than reading. Option B. Contradictory choices should be selected first. Option C. All choices are equally likely after reading. Option D. Eliminating impossible choices can improve test accuracy. The correct answer is option. The strategy reduces the number of plausible answers. Guessing is always better than reading is not supported by the passage. Contradictory choices should be selected first is not supported by the passage, and all choices are equally likely after reading is not supported by the passage. Question 6. Given the information in a nerve signal item, which inference is best supported by the passage? A short article explains that dehydration can cause fatigue, headache, and dark urine. Option A. The article reviews bone injuries. Option B. The article teaches grammar rules. Option C. The article is mainly explaining signs of dehydration. Option D. The article compares hospital departments. The correct answer is option. All listed details point to symptoms of dehydration. The article reviews bone injuries is not supported by the passage. The article teaches grammar rules is not supported by the passage, and the article compares hospital departments is not supported by the passage. Question 7. Suppose a similar endocrine message item appears on test day, which inference is best supported by the passage? A paragraph states that teamwork improves safety because it helps staff catch errors early. Option A. Errors are always intentional. Option B. Communication is unrelated to safety. Option C. Teamwork removes the need for training. Option D. Teamwork can reduce mistakes by improving communication. The correct answer is option. The passage explains how teamwork supports safety. Errors are always intentional is not supported by the passage. Communication is unrelated to safety is not supported by the passage. And teamwork removes the need for training is not supported by the passage. Question 8. While working through a timed glucose regulation set, which inference is best supported by the passage, a student highlights every sentence and later cannot identify the main point. Option A. Highlighting too much can make key ideas harder to find. Option B. Main ideas should never be located. Option C. Highlighting guarantees understanding. Option D. Every sentence is always equally important. The correct answer is option. The problem comes from failing to distinguish key information from details. Main ideas should never be located is not supported by the passage. Highlighting guarantees understanding is not supported by the passage, and every sentence is always equally important is not supported by the passage. Question 9. Before choosing an answer in a chart reading item, which inference is best supported by the passage, a clinic sends appointment reminders, and missed visits decline. Option A. Reminders can help patients remember appointments. Option B. Patients cannot benefit from reminders. Option C. Reminders caused more missed visits. Option D. Appointments no longer need scheduling. The correct answer is option. The decline in missed visits supports the role of reminders. Patients cannot benefit from reminders is not supported by the passage. Reminders cause more missed visits is not supported by the passage, and appointments no longer need scheduling is not supported by the passage. Question 10. A student sees this ratio setup idea on a NEX review, which inference is best supported by the passage. A science passage explains that enzymes work best within certain temperature ranges. Option A. Enzyme activity depends on conditions such as temperature. Option B. All enzymes work best when frozen. Option C. Temperature never affects proteins. Option D. Enzymes are not involved in reactions. The correct answer is option. The passage focuses on how conditions influence enzyme function. All enzymes work best when frozen is not supported by the passage. Temperature never affects proteins is not supported by the passage, and enzymes are not involved in reactions is not supported by the passage. Question 11. 1-unit conversion practice problem tests this skill, which inference is best supported by the passage. A paragraph describes a problem, then lists 3 practical ways to solve it. Option A. The paragraph is a poem. Option B. The paragraph is only chronological. Option C. The paragraph avoids solutions. Option D. The paragraph uses a problem solution structure. The correct answer is option. It first identifies a problem and then presents solutions. The paragraph is a poem is not supported by the passage. The paragraph is only chronological is not supported by the passage, and the paragraph avoids solutions is not supported by the passage. Question 12. Several choices look tempting in a percentage item, which inference is best supported by the passage. A medication label says to shake the bottle before measuring the dose. Option A. Dose accuracy does not matter. Option B. Measuring should happen before reading labels. Option C. Shaking helps distribute the medication evenly. Option D. Shaking changes the drug into water. The correct answer is option. Some liquid medications need mixing for an even dose. Dose accuracy does not matter is not supported by the passage. Measuring should happen before reading labels is not supported by the passage, and shaking changes the drug into water is not supported by the passage. Question 13. For this fraction item nursing entrance question, which inference is best supported by the passage, a passage notes that older adults may be at higher fall risk because of vision changes and muscle weakness. Option A. Vision changes prevent injuries. Option B. Older adults never fall. Option C. Age-related changes can increase fall risk. Option D. Muscle weakness improves balance. The correct answer is option. The passage names changes that can make falls more likely. Vision changes prevent injuries is not supported by the passage. Older adults never fall is not supported by the passage, and muscle weakness improves balance is not supported by the passage. Question 14. In a shortening score practice STEM, which inference is best supported by the passage, a study found that students who practiced with timed sets felt more comfortable during the actual exam. Option A. Timed practice can build exam familiarity. Option B. Comfort never changes with practice. Option C. The exam has no time pressure. Option D, timed sets remove all content gaps. The correct answer is option. The passage connects timed practice with increased comfort. Comfort never changes with practice is not supported by the passage. The exam has no time pressure is not supported by the passage, and timed sets remove all content gaps is not supported by the passage. Question 15. Among the choices in a probability set item, which inference is best supported by the passage? A chart compares 3 study methods and shows the highest scores for mixed review sessions. Option A, mixed review had the lowest score. Option B, mixed review sessions produced the strongest outcome in the chart. Option C, all methods had identical results. Option D, charts cannot compare outcomes. The correct answer is option. The chart identifies mixed review as the highest scoring method. Mixed review had the lowest score is not supported by the passage. All methods had identical results is not supported by the passage, and charts cannot compare outcomes is not supported by the passage. Question 16. Using the facts in a test strategy question, which answer best explains the author's point? A community clinic added evening hours, and attendance increased among working adults. Option A, working adults avoided the clinic more often. Option B, the clinic stopped serving adults. Option C, evening visits made all care free. Option D, expanded hours improved access for people who could not visit during the day. The correct answer is option. The passage links evening hours with increased attendance among working adults. Working adults avoided the clinic more often is not supported by the passage. The clinic stopped serving adults is not supported by the passage, and evening visits made all care free is not supported by the passage. Question 17. Based on the clue in a main idea item, which answer best explains the author's point? A student reread difficult paragraphs and wrote a one-sentence summary after each one. Option A, summaries should replace reading. Option B, skipping hard paragraphs saves time. Option C, active review can improve understanding of complex text. Option D, only long notes improve reading. The correct answer is option. The student uses summarizing to check meaning after reading. Summaries should replace reading is not supported by the passage. Skipping hard paragraphs saves time is not supported by the passage, and only long notes improve reading is not supported by the passage. Question 18. Consider this high-yield inference clue concept, which answer best explains the author's point. A hospital placed hand sanitizer near every doorway, and staff use rows during shift changes. Option A, doorways cause infections by themselves. Option B, staff should avoid sanitizer during shifts. Option C, making supplies easy to reach can support safer habits. Option D is safety improves only through written rules. The correct answer is option. The change made the desired behavior easier and more visible. Doorways cause infections by themselves is not supported by the passage. Staff should avoid sanitizer during shifts is not supported by the passage, and safety improves only through written rules is not supported by the passage. Question 19. Near the end of a author purpose review session, which answer best explains the author's point? A patient education sheet used short sentences, headings, and pictures. Option A, headings reduce the value of information. Option B, clear formatting helps readers understand health information. Option C, pictures make written instructions unnecessary. Option D, long paragraphs are best for patient teaching. The correct answer is option. The sheet is designed to improve readability and comprehension. Headings reduce the value of information is not supported by the passage. Pictures make written instructions unnecessary is not supported by the passage, and long paragraphs are best for patient teaching is not supported by the passage. Question 20. Across similar summary task nursing entrance questions, which answer best explains the author's point? A researcher noticed that larger sample sizes produced more stable survey results. Option A, small samples always prove a theory. Option B, large samples remove every error. Option C, more data can make results more reliable. Option D, surveys do not need participants. The correct answer is option. The passage emphasizes stability from larger samples. Small samples always prove a theory is not supported by the passage, large samples remove every error is not supported by the passage, and surveys do not need participants is not supported by the passage. Question 21. Since only one choice fits the sentence correction clue, which answer best explains the author's point, a nurse calmly repeated discharge instructions and asked the patient to explain them back. Option A, discharge instructions should be avoided. Option B, patients should memorize medical terms first. Option C, teach back checks whether the patient understands instructions. Option D, repeating words proves the nurse is confused. The correct answer is option. Having the patient explain instructions confirms understanding. Discharge instructions should be avoided is not supported by the passage. Patients should memorize medical terms first is not supported by the passage, and repeating words proves the nurse is confused is not supported by the passage. Question 22. From the information in a punctuation review item, which answer best explains the author's point? A graph showed water intake rising each week after reminders were added to a wellness app. Option A. The graph proves reminders cure illness. Option B. Reminders may have encouraged more consistent water intake. Option C. The app removed the need for habits. Option D. Water intake decreased every week. The correct answer is option. The passage connects reminders with increased intake. The graph proves reminders cure illness is not supported by the passage. The app removed the need for habits is not supported by the passage, and water intake decreased every week is not supported by the passage. Question 23. At a testing desk during a pronoun agreement review, which answer best explains the author's point? A paragraph compares online classes with classroom learning by discussing flexibility, cost, and interaction. Option A. The paragraph lists only causes. Option B. The paragraph tells a fictional story. Option C. The paragraph gives a step-by-step procedure. Option D. The paragraph is organized by comparison and contrast. The correct answer is option. The paragraph examines similarities and differences between two learning formats. The paragraph lists only causes is not supported by the passage. The paragraph tells a fictional story is not supported by the passage, and the paragraph gives a step-by-step procedure is not supported by the passage. Question 24. Inside a parallel structure science or skills item, which answer best explains the author's point? A volunteer program grew after former patients shared personal stories at orientation. Option A. Former patients stopped the program. Option B. Volunteer programs grow without communication. Option C. Personal stories can motivate people to participate. Option D. Orientation should never include stories. The correct answer is option. The passage shows participation increased after meaningful stories were shared. Former patients stopped the program is not supported by the passage. Volunteer programs grow without communication is not supported by the passage, and orientation should never include stories is not supported by the passage. Question 25. Through careful reading of a active voice stem, which answer best explains the author's point? A study guide placed key formulas in boxes and practice questions beside each formula. Option A. Formulas should never be practiced. Option B. Practice questions replace all instruction. Option C. Boxes make formulas incorrect. Option D. Pairing formulas with practice helps students apply concepts. The correct answer is option. The guide connects a rule with immediate application. Formulas should never be practiced is not supported by the passage. Practice questions replace all instruction is not supported by the passage, and boxes make formulas incorrect is not supported by the passage.